Welcome to the Cardiac Family Channel. Today we are going to discuss about two basic fundamental terminologies in cardiac sciences called as heart attack and cardiac arrest. And what is the difference between both of these terminologies? Hey, this is Dr. Avinash Inamdar. I am a cardiac surgeon. On my right you have Dr. Sanjeevani, who is a cardiac anesthetist, intensivist as well as echocardiologist. And to her right you have Dr. Sonali Inamdar, who is an interventional cardiologist. So let us first understand the basic definition of these two terminologies, because there are so many viewers who asked me to make a video on this particular topic because there is a lot of confusion. People just do not understand what is what.
And that's especially because many newspapers have, claimed various headlines of different celebrities. Oh, this one has had a heart attack, that one has had a cardiac arrest. So people have been confused and alarmed both at the same time.
So let us first understand what is cardiac arrest.
Okay, so cardiac arrest is sudden cessation of the heart pump.
Stoppage of heart.
Cessation of the function or stoppage or malfunction and total stoppage of the
So the heart is
pump.
Not contracting at all. That is cardiac arrest.
And it happens suddenly, and because it is the main organ of our body, if it stops working, then it affects all the other organs. So then your breathing also stops and your consciousness also goes away. So you basically are unconscious also and you are not breathing.
That is cardiac arrest. Again, technically going deeper, as we all know that there is a systolic cardiac arrest and a diastolic cardiac arrest. Systolic is what we call as ventricular fibrillation, or a diastolic or what you call a flat light. Now on the other hand, you have heart attack.
Right.
Now what is heart attack?
Heart attack is when a portion of the heart muscle is affected because of 100% blockage of the artery which supplies that heart muscle.
Right.
So this occurs, again this does occur suddenly. Usually there's a plaque rupture, that is, the lipid deposition inside the inner lining. It is a vulnerable lipid deposition, and over there suddenly a clot, blood clot gathers there, and suddenly the blood flow to that segment of the heart stops. So the entire pump doesn't stop. A portion of the heart pump is stopped because of this 100% occlusion.
Right.
So that is a heart attack.
That is heart attack. Now there are few questions which people ask me. Can there be a cardiac arrest without a heart attack?
Yes. There can be, of course. There are
cardiac heart attack is one of the causes of cardiac arrest.
That is one of the commonest causes of a.
So what are the other causes? What are the other causes?
So the other causes are somebody who has arrhythmias due to not related to a heart attack. So we have a lot of congenital and non-congenital causes of arrhythmias. Then there are cardiomyopathies, that is the muscle itself is diseased, and there are various numerous causes of cardiomyopathies. So these of course not as common as a heart attack.
Runners, when they succumb while running, one of the reasons is cardiomyopathy.
Yeah, very important. Because you have something known as the athlete's heart, which is a compensatory phenomenon which happens in the heart muscle to the fact that the person has been running for so many years, and that's a normal compensatory phenomenon. But of course some changes, metabolic changes, can occur in a runner's body which can affect the heart muscle and suddenly lead to cessation.
So there are many other causes which can cause a stoppage of heart or a cardiac arrest other than a heart attack. This is what the viewers should understand, because many often it is equated. Cardiac arrest,
no, it's not the same. It's not the same.
It is equated.
Besides, there are many other organs like kidney failure or brain stroke or any other brain coning of the brain.
Or hyperkalemia, potassium electrolyte, or causing stoppage of heart.
Or lung disease. Anything can cause heart attack, heart stoppage.
Hypoxemia, there is low oxygen.
On the other hand, can there be a heart attack without a cardiac arrest?
Yes, I mean more often than not.
95% or 99% it is a heart attack without cardiac arrest, and it is the risk or it is the fear of having a cardiac arrest for which you rush the patient to the hospital.
Yes, absolutely. That is the main thing.
So when there is a cardiac, when there is a heart attack, the whole philosophy and the whole protocol, as you all know, you rush to the hospital.
We've
get
discussed
all
it
the
in
things.
the
We
video
have
on
discussed in so many things. Yeah, so that's very
angioplasty.
simple to understand, and we all know, and we'll
Yeah.
be discussing on that particular topic again and again.
Right.
But then coming to cardiac arrest. Suppose someone has a heart attack in the house, the heart stops. Then what we do? You have to first call an ambulance, but
have to
till
call
that
for
time,
help first,
you
of
have to
course.
do something called as the
CPR.
cardiopulmonary resuscitation, in simple terms called as CPR. And CPR again is either only hands only CPR,
Right.
what you call as
Compression only.
compression only, life
without
supports,
any
coals,
mouth-to-mouth
what you call as
breathing.
coals.
Okay.
Or of course the conventional one, compression with intermittently mouth-to-mouth respiration.
Right.
So this is just
And
buying
one
time.
important thing over here is, if the heart attack is due to systolic heart attack, like
Yeah.
fibrillatory heart
Yes,
arrest,
yes.
not heart attack, I mean cardiac
Cardiac
arrest.
arrest, yeah.
There is one machine called as defibrillator,
Defibrillator, yeah.
and you have to just apply those pedals, which
Yes.
is trained to lay person is also
Yeah, and you
nowadays
see these
allowed
defibrillatory
to-
machines
Huh.
in
And now
public places.
they are
right.
there at
And
many
then-
places.
Right.
Even on the airports,
You
I saw
have
a
to
lot
just
of.
give the shock to the heart,
Yes.
and then the heart again comes back to its original rhythm.
Yeah.
And many societies are also now opting
Yes.
for it, training the layperson,
Yes.
training the other personnel who are in association with that society. And it
basically,
is allowed to.
This compression technique or CPR is a technique to improve or maintain blood supply to the brain, basically, because the brain cannot survive ischemia or stoppage of blood supply for more than 8 to 10 minutes. So that is the main reason.
Absolutely.
Because the most vital organ is the brain. Well, other kidney,
After the
liver,
heart.
and after that.
After that.
So till you buy time.
Because we
till-
don't want patient to be brain dead and heart is running.
Yeah,
Yeah,
that
that
is
situation
that
we
is
don't
the worst
want.
situation to happen. You see,
And I think it
that's
is 4 minutes. Brain
Yeah.
is, I think, 4 to 5 minutes.
ideally, yeah. So you
That
have
is
to.
known as golden
I know
hour.
so
golden
many,
hour.
so many people we have seen, they are brought to the hospital with the massage going on,
Yes,
cardiopulmonary
But
research is done.
it is life saving. It
Yes,
does.
yes.
Sometimes cardiac massages for as long as 1 hour
Yes,
have
yes.
have
They have
saved.
survived. This
have
has
saved
happened
patients.
in our
Yeah.
hospital
Yes, yes,
long
yeah.
time
We
back.
have
I
done,
remember. In fact,
I
I
have-
gave it up after 15-20 minutes, but
Yeah,
she
but
said
she
no,
did.
I'll
She
continue,
did, yeah.
and she could revive the patient, and who survived
Was
and lived.
politically very important
Yes.
person, and then he was revived.
And yes.
Actually, his son was telling me that please stop, madam.
Yeah.
It is not going to help. But
And
I
he was
said-
alive for the next 20 years after that.
he
yes.
did have important position.
So
in
that's a
the-
very important technique of
Yeah.
cardiopulmonary resuscitation. And ladies and gentlemen, we will be having a full video on cardiopulmonary resuscitation techniques in the next one. And for that, continue to watch our videos and understand this basic fundamental difference between heart attack and cardiac arrest. So see you again in the next video, and have a great weekend. If you like the video, just share it and subscribe to our channel. Thank you very much.